Thank you so much, everybody, for coming out in the middle of the week. You guys are very dedicated, and it's a real pleasure to be back in Sweden. I think this is my 4th time here, so I call this my second home. And I did my ancestry, and I am part Swedish, so it's good. So I'm going to talk primarily about lipedema today, but I also want to talk about Derkum's disease as well. I don't have any disclosures. I really want to bring up a new term called adipofascia. So we're all looking for another term instead of fat, right? Nobody likes the word fat, and there's a lot of fat shaming in our society, so adipofascia may be a different word. I want to talk a little bit more about what's going on in the lipedema tissue, and also talk about fibrotic tissue, and then talk about treatments. And also empower people to take care of themselves. So I'm going to start with fat. This is an example of a cartoon of fat cells. And whenever we think of fat, we just think of fat, right? But in fat, you've got immune cells, you have blood vessels, you have lymphatics, and you have nerves. And the fat on the outside of the body makes up about 80% of our total body fat. So if you have a problem with the fat on the outside of your body, your whole body really is affected. It's a systemic effect from that fat. And we call this fat loose connective tissue. And that if you look it up, if you go online and you put in what is the definition of fat, what pops up? Loose connective tissue. So you can say, I have a connective tissue disorder if you have lipedema or you have Derkum's disease. And I think that might be a little bit more friendly term to use, and it's actually a little bit more accurate. We know that fat secretes a lot of different hormones, and it also secretes free fatty acids. So if the fat on the outside of your body is sick or it doesn't work very well, then your fat isn't secreting those hormones, or it's secreting different hormones, and it's not communicating properly with your body. Part of fat is fascia, and I'm going to talk a little bit more about exactly what fascia is, and there are different kinds of fascia. For example, blood and lymphatic fluid are called liquid fascia. But the fascia I'm talking about in fat is a sheet of connective tissue that's a little bit firmer. It's in between fat cell layers, and it's also under fat on top of muscle. It connects to the muscle itself, and it also connects to bone. So if you have a problem with your loose connective tissue on the outside of your body, it's going to affect every other structural part of your body. So it shows how important our fat is. So I'm going to review the fat disorders now. So we'll start with lipedema. So lipedema by definition is a disorder of loose connective tissue. It's also a disorder of adipofascia. And it affects primarily women, and it affects their arms and legs. It affects their hands, their feet, and their trunk less. And it occurs at times of hormone change, right? We've all heard that. Puberty, pregnancy, menopause, right? But what I want you to think about is that at those times of hormone change, what's going on with the body? You're gaining weight, right? You gain weight at puberty, you gain weight during pregnancy, and you gain weight during menopause. So it could be the weight change that's important during those times. And you also change the shape of your body. So you change the structure of your body. So I don't have the answers, but I think that's something we all need to think of. It's not just hormones, it's also a change in weight. And we also know that lipedema fat can be very painful. Some areas can have no pain, other areas can have excruciating pain. The fat tissue can also become very heavy, and we say it's full of fluid, but the question I have is how does that fluid stay in the fat? Why doesn't it dribble down? And I'm going to give you an idea. We also know there's a lot of fibrosis in adipofascia in women who have lipedema and people who have Derkum's disease. And we know we can find masses within lipedema tissue or Derkum's disease tissue, and they can be of all sizes. And we know that lipedema is worsened by gaining weight, by polycystic ovarian syndrome, by inflammation, by inability to move or dysmobility, by hypermobile joints, and by lymphedema. And we also know that lipedema is a chronic disease. And now I'm going to present to you kind of a new way of looking at Derkum disease, different types. So this is a work in progress, and I have been talking to Team Derkum about it, and hopefully we'll solidify this at some point soon. But instead of calling it by the shape of the nodules in the tissue, which can be very confusing, that the first type of Derkum's disease is in families who have familial multiple lipomatosis. Their lipomas tend not to be painful, but one or more people in the family will develop pain along with their lipomas. And we don't know exactly why, and then we call it Derkum's disease. But that doesn't tell you about the history of that person. It doesn't tell you about the family that they're in. And so I would like to call this a familial multiple lipomatosis type. And then we have angiolipomas, right? So people with Derkum's disease can have angiolipomas. They can be as small as a grain of rice. They can be as large of a fist or larger. So again, different sizes, and we don't talk about the history of angiolipomas. So I think angiolipoma type would be a good name for that type of Derkum's disease. And then there's the toxic type. And Sue was telling me that that might be a kind of a scary term, you know, hey, you're toxic. And so maybe we should call it the metabolic type, or we'll come up with a different name that really describes that the body has failed to heal. It's not healing correctly. So when you fall down and you scrape yourself, you usually heal. But if your body got sick from surgery or an infection or a trauma, a huge trauma, and the mitochondria fail to heal you, then you're in this chronic failure to heal. And that's what the literature calls it. It's a healing disorder. And so you can have familial multiple lipomatosis and have a healing disorder. You can have lipedema and have a healing disorder. You can have no connective tissue disorder and have a healing disorder. So it can happen to anybody, but it also is associated with a change in the adipofascial structure. And we know that these are chronic disorders, and we know that they're considered rare. We also know that people with Derkum's disease have problems with their lymphatic system, and this makes perfect sense. If you have inflammation in your body, your lymphatic system is going to pump slower. It's going to work less well. And there's 2 articles that have been published on that, and so I really truly believe this to be true. I had a young guy who was in the hospital. He had angiolipomas, and he had pain in his back and in his left leg. That was his main pain. He could barely walk. He needed opioid medication to treat it. We did a test to look at his lymphatic system, and the only place his lymphatics were slow on his body were his left leg. And that's where his primary amount of inflammation was. So if you have widespread inflammation in your body, your entire lymphatic system can be slow. And finally, primary versus secondary lymphedema. We think that it's possible that women with lipedema have an underlying primary lymphedema. So that's an inherited disorder. And it often affects the legs more, so that goes right along with lipedema, and it affects women more than men. So that's got to make you think, and this is not proven, this is an idea that we're kind of bouncing around right now. And then there's secondary lymphedema, where you have a surgery or you have lymph nodes removed, and you get some sort of damage to the lymphatic system, and then it doesn't function as well. And we think that you can have a combination of primary and secondary lymphedema, and that we can see this in many of the connective tissue disorders. And these are also chronic disorders, and they're at risk for adipofascial disease. So this is a woman who has breast cancer associated lymphedema, so stage 3 lymphedema. So it's very advanced, and I think you can easily see that her hand is swollen, and that's pathognomonic for lymphedema. But when they did a surgery on her, you can see that most of her limb is not fluid, it's fat. And inside the fat, you can see white lines. That's scar tissue. So this woman with lymphedema has an adipofascial disorder. And so I think Derkum's disease, lipedema, and lymphedema are all on the spectrum. And that's kind of why we're here tonight. So let's go on to talk about why your hands are normal in lipedema. So this is an idea. So in lymphedema, we know that there's free flowing fluid within the tissues because there's been damage to the lymphatic system. There's either obstruction or they weren't formed in the first place, which can happen in primary lymphedema. And so if it's free-flowing fluid, it's going to dribble down the limb and end up swelling the foot, or dribble down the arm and end up swelling the hand. But what may be going on in lipedema is that the water is getting bound up to these molecules called glycosaminoglycans. And glycosaminoglycans are sugar molecules. And they're very complex sugar molecules. And when they bind up water, it forms a gel. And if it forms a gel inside your tissue, do you think you're going to have good flow through the tissue? No. Do you think it's going to be heavy? Have you ever picked up a Jell-O mold and you're like, wow, that's really heavy? So you think of, you have a Jell-O mold inside your arm becomes very heavy, and your hand is fine. Nothing dribbles down because it's bound up in gel. So let's go back and talk a little bit about fascia. If you want to read about fascia, this is actually a pretty good site. It's a blog that's easy to understand. It's called painscience.com. And circled there is the thoracolumbar fascia. So it's a sheet of connective tissue. But do you see the white connective tissue all over the body? Starts on the head, goes all the way down to the bottom of the foot? That's your fascia. So if you have problem in one area of your fascia, there's a tightness, there's an inflammation, a contraction, it's going to affect the entire rest of your body because the rest of your body can't move normally, right? And this is an example of the heart from a pig, and they've removed everything but the fascia. Do you still see the heart? So even our heart, even our organs are all made up of fascia. We are all made up of fascia. So if you have inflammation in one area of your fascia, you could see how it could easily pass to the rest of your body. And that when you think about your fat being inflamed, it's not just your fat, it's also your fascia. So let's look at ladies with lipedema with new eyes, thinking about the fascia. So in stage 1, you can see the skin is smooth. If you feel it, you can feel the lumpy, bumpy fat underneath, and it could be tender. And then in stage 2, you start to see the dimpling, right? So the underlying fascia is starting to ripple and contract and become fibrotic. And you can see her knees have come together, so that it's affecting the structure of her body. It's starting to affect her joints. And her ankles are starting to bend inward. They're starting to pronate. And then look at stage 3. The fascia has become so weak, it's stretched out and it's folded over. So it's not just fat growing out and flopping over, it's a change in that fascia structure. So both fat and fascia have changed, and this is pretty clear now. You can see it now, right, in your mind, that fascia stretching out and drooping. And we looked at 46 women, and we were able to prove that as you go up in stage, the body mass index goes up. So these women get bigger. And we looked at them a different way by bioimpedance, where you stand on a scale and electricity passes through your body, and it tells you how much fat and muscle you have on your body. So you can see by stage, the amount of fat on the body goes up. So that's pretty clear. So what do you think happens with muscle? Should it go up, down, stay the same? Go down, up? So usually you would think it would go up, right? If you're carrying more weight, you need more muscle mass, right? But what we found in lipedema was it stayed the same. So that's this lean body mass is muscle mass. So we found that lipedema fat mass, but not muscle mass, increases by stage. And that's not what should happen, because when you look at people who don't have a connective tissue disorder, their muscle goes up with weight to hold the body. Their bone mass goes up with weight. So there is something wrong with the muscle in lipedema as well. It's not just a problem with fat. And where do you find the fascia? All over, right? All around the muscle. So it makes sense that it's not just an isolated problem with fat. And the problem is, as we age, we get more fibrosis in our muscle. So as we sit in this room, every second that ticks by, right, we're at greater risk for fibrosis in our muscle. So people who have a connective tissue disorder like lipedema and Derkham's disease and lymphedema, they're all at risk for muscle damage. And I know it's like gloom and doom here, right? This is really bad. Just to give you a little hope, that there is a big push to develop new medications for treating fibrosis. They're looking to treat fibrosis of the liver, and they're looking to treat fibrosis of the lung. And this is an example of a medication that's available to treat fibrosis in muscle. So this is all good for us. Maybe, you know, one of those medications will be good for treating lipedema or Derkham's disease. So let's go back to our ladies with lipedema, the 3 different stages. So and I know that's fuzzy and I apologize, but we wanted to know what happened as their body mass index increased. And what we found was that their blood pressure went up. Their systolic blood pressure and their diastolic blood pressure went up with stage. And their happy, healthy HDL cholesterol, their good cholesterol, went down with stage. But look at the amount of diabetes. Out of 46 women, 1 had diabetes. But yet they're having signs and symptoms of prediabetes. And when we looked at the prediabetes percent, none in stage 1, 12.5% in stage 2, and 30% in stage 3. So even though you don't have diabetes, your healthcare provider might say, good job, you know, you have a lot of weight, but you don't have diabetes. That's great. Go home. I think that as a woman with lipedema or anyone or a person with Derkham's disease, if you have excess weight in your body, you should be talking to your provider about your metabolism. And you should be asking for your hemoglobin A1C to be checked. And a lot of times it's normal, and most doctors stop there. But my feeling is you should check your insulin and your glucose level. Your fasting insulin, your fasting glucose, or you can do an oral glucose tolerance test and have your sugars and your insulin checked to see if you're insulin resistant. You can, if you get your fasting insulin and glucose, you can go online and you're going to look for this, HOMA index, H-O-M-A index, and it stands for homeostasis index. And what it means is that it tells you whether you're insulin resistant or not, just by looking at your insulin glucose level. It'll spit it right out. There's a lot of different websites that do it now. If your insulin is too high and your glucose is completely normal, you have insulin resistance and you probably should be treated. So that's something you can discuss with your provider. You should also follow your cholesterol over time with a lipid panel, and you can do that. You shouldn't depend on your provider to do that. You could follow your own lipid panel over time. If it looks like it's starting to go in the wrong direction, you can alert your provider. And also, you can measure your waist right at your navel. You can measure your waist over time. If your waist is getting bigger and bigger over time, that's a sign that metabolically you're going in the wrong direction. Again, you shouldn't be relying on your provider. That's something you can do at home. You can measure it every month. You can measure it every 6 months. You can measure it every year. And finally, you should do the same with your blood pressure. Is your blood pressure slowly going up over time? If it is, then you can catch your prediabetes early rather than waiting until you have diabetes. So you might think that this lady with stage 1 lipedema is doing great. She's not obese, right? So what we did biopsies, and we put these ladies with lipedema into 2 groups, non-obese or women living with obesity, and we had controls or ladies with lipedema. And what we found was in the ladies who had lipedema but did not have obesity, they had really big fat cells. And those really big fat cells were the same size as ladies who had obesity. And that was really news to us. We thought that these ladies were super healthy, but actually they're not. Large fat cells are called hypertrophic fat cells, and they are a marker of a metabolically bad environment. We call it sick fat or addisopathy. So these ladies who didn't have obesity had sick fat, but they didn't have diabetes. They look really good on paper. So there's healthy fat and there's unhealthy fat or sick fat. And in this unhealthy fat are these large fat cells, and they pop. They get sick, they send out signals and say, I'm sick, and they actually die. And so your body sends in these macrophages to come eat them up because they don't want dead cells sitting around. And when you have dead cells and you have macrophages and other immune cells, you get a situation called hypoxia or low oxygen. And when you have low oxygen, you develop fibrosis because your body wants to fill in the bad areas with dead fat cells. Now these big fat cells don't function as well. So if you're small fat cells, you're able to move receptors to the surface of the cell and communicate with the body. You just stick that out there and you can bind insulin and take up sugar. But the fat cells that are large can't do that. They don't function as well. And so you see, instead of sticking the receptors out, the receptors are getting lost in the cell. So these cells have now become insulin resistant, and that's why they're bad in the body. So I want to try and explain now why people with lipedema, lymphedema, Derkham's disease, adipofascial disease can't lose their fat by diet, exercise, or bariatric surgery. So if we look at mice, and the mice are either skinny or they're obese, and we're looking at either fat inside the belly or outside the body, you can see that in the mice that are obese, they have increased fibrosis in the fat. And this fibrosis is around the fat cells. It's between the fat cells. It's moving the fat cells further apart. And so they, and that area here is called the interstitial matrix. You know, the new organ, did you hear about the new organ that's in between cells? That's it. That's where the fibrosis sits, which is not good because things are supposed to be flowing through there. If you have fibrosis, things are going to get stuck. So they looked at people after they did biopsies and estimated how much fibrosis they had in their fat. Then they gave them bariatric surgery and said, how much weight did you lose after a year? And the people who had more fibrosis in their fat lost less weight. And so they think this fibrosis is responsible for the inability of people to lose weight. And just to drive that point home, here's another study. They looked at people who were insulin sensitive and obese, insulin resistant and obese, or people who were obese and had type 2 diabetes. And they looked at them before and after bariatric surgery. Do you see a big change in fibrosis there? No, right? So again, a second study, and I could show you more and more. This is a young lady who has lipedema and obesity, and she had bariatric surgery, and this is 1 year post. And you can see that her legs are approximately the same size. She lost a good amount of fat from the belly. That's pretty clear. She did lose some fat on her arms, but the legs stayed essentially the same. So what is tissue fibrosis? Another term for it would be scar tissue. And scar tissue happens when you don't heal correctly, right? And I talked about a healing disorder, right? So this is starting to gel together, hopefully. And when you have a healing disorder, you have inflammation, the inflammatory cells signal the fibroblast to start laying down scar. And it will lay down scar anywhere. And it can actually result in organ failure, like failure of kidney function. Well, fat is an organ. So it can result in failure of your fat to function normally. And inflammation is a major contributor to fibrosis. So this is what lipedema fat tissue looks like. And you can see that this area in between the cells is filled with little fibrils. That's the fibrosis. That's the same thing that we saw in those mice, right? And this fat cell is moving further away from the blood vessel here. So this cell is not getting a lot of oxygen from that blood vessel. So this cell is in trouble, and it's probably sending out signals like, hey, I have low oxygen, and in come the immune cells. Now, how does this happen? You know, how does this fibrosis fill it in? How does it push the cells away? So if we think about normal flow through fat, you've got your blood vessel, it releases nutrients into the tissue, it flows through, the cells take what they want, they release their cell waste, and the remainder of the fluid and cell waste material gets taken up by that lymphatic vessel. And these are really small capillaries or blood vessels. In lipedema tissue, because the tissue loses elasticity, remember that fascia starts to become lax and fold. The cells just move apart from one another as the fluid comes in. And you can see these eddies that form. And as fluid sits there, it starts to deposit things down like sediment. So it deposits proteins down there and other things that are in the blood, including cell waste material, right? And again, the fat cells are like, hey, I'm getting further away from my blood vessel. We're in trouble. And it signals for immune cells to come in. So there's hypoxia. It recruits immune cells, resulting in inflammation and fibrosis. All right, so let's look at data to make sure that that's actually true. So we're looking at people who don't have obesity and people who have obesity. So we're looking at any area of the body that has excess fat. So we're looking at abdominal fat in the triangles, or we're looking at femoral fat or girl fat on the hips, thighs, and buttocks, right? So if you have any excess tissue in those areas, flow through the tissue, blood flow through the tissue is down. And the reason it's down is likely due to fibrosis. Exactly right. Perfect. So now, let's say we take electricity and we force the nerves to activate within the tissue. That ought to get things flowing, right? That ought to work. And we should be able to resolve lipedema fat tissue and Derkham's disease fat tissue by shooting electricity in there, right? So if you look at individuals who are lean, when they shot electricity through the femoral area, the fat cells were like, hey, and they released a lot of fat. But when they did it in people who had obesity in the femoral area, nothing happened. So even electricity, even shooting electricity through the tissue is not activating it because of fibrosis. Exactly right. So when you slow flow through fat tissue, this results in lymphatic stasis, and guess what? Fat cells love it. They're sitting in a soup full of nutrients, and they start growing. So you slow down flow because of fibrosis, and your fat grows, and it starts to become a vicious cycle over time. And we also know that in women and men, if you develop fat in the femoral area or the female area, you aren't going to metabolize as well. That fat in that area does not metabolize as well as fat on the abdomen. And it's intimately linked to estrogen. So the minute you have estrogen in your body, the female fat starts to become less metabolic. It hangs around. And why does it do that? Evolutionary-wise, it makes sense, right? We need that female fat to have children. We need that female fat to breastfeed. If that fat could easily go away, then we're not going to be able to be fertile in times of famine. And that's a theory, but I think it's true. So here we have our inflamed fat that eventually becomes fibrotic. Is there any proof that we really have inflamed fat? So in those biopsies that we did of women with lipedema, again, we looked at women without obesity and with obesity, and it doesn't matter. If you have lipedema, you're going to have more macrophages in your tissue. So lipedema is an inflammatory disease. And what happens after inflammation? Fibrosis. And one of the fundamental features of inflammation is increased vascular permeability. So when you have inflammation, your vessels become leakier and you dump even more fluid out of the vessels in between the fat cells. And so when we looked at women who had lipedema, we found that 30% had these really unusual blood vessel structures. And there were many, many blood vessels clumped together, and it looked exactly like an angiolipoma that you would see in Derkham's disease. And we saw our first one, and I said, oh my goodness, we biopsied someone with an angiolipoma. That can't be true. And I looked to see who it was from, and I said, oh my gosh, that's a lady with lipedema. So we went back through all of our samples, and sure enough, 30% had this angiolipoma-like tissue. And these are just different stains proving that there's fibrosis here with a trichrome stain, and that we proved that they were actually blood vessels. And where else do you see this besides angiolipomas? You see it in massive localized lymphedema. So when you have a fold of tissue that's got lymphedema, you can call it massive localized lymphedema, you could call it massive localized obesity, but it got a bunch of blood vessels and a lot of fibrosis. So we think that lipedema is on the spectrum of lymphedema, and this is one reason why. And whenever you have angiogenesis that accompanies inflammation, this just prolongs the inflammatory response. So you can see poor flow, angiogenesis, inflammation, poor flow, and it just keeps going. And also when you have increased fat tissue that you got because you had poor flow and the fat were sitting in that soup, you're at high risk for venous insufficiency. And if you have venous insufficiency, more fluid flows into the tissue. And venous insufficiency and obesity are two of the leading causes of lymphedema. And that's why women with lipedema and people with Derkham's disease are at risk for developing lymphedema. So let me go through some treatment recommendations. Do diets reduce fibrotic fat? Okay, next. So we have no data to suggest that that's true. We do know that eating healthy and keeping your weight down is really important to reduce obesity. So that can be done. But once the fat becomes fibrotic, it becomes extremely difficult to lose. And we think that there could be some sick fat mixed in with the lipedema fat. So when you lose weight, you can actually lose weight from areas of lipedema, but you still leave that fibrotic lipedema fat behind. We know that liposuction for lipedema, whether it's tumescent liposuction or water jet-assisted liposuction, is really good for reducing fat. And in fact, I think it's one of the best ways to reduce fibrotic fat. It reduces pain, it improves quality of life, and I've been doing it myself on a research basis, and I am amazed at how much fibrosis there is in the tissue. And even if I just break up the fibrosis and remove almost no fat, there is a healing that can go on, and people can actually lose tissue in that area. So my opinion is if you seek liposuction, it would probably be a good idea to remove as much obese fat as possible, however you can. However, we really need to individualize the treatment, because if you can't lose the weight, then you would never be given liposuction. So I think it's something to keep in mind and discuss with your provider if you're planning on doing liposuction. We have found in my clinical practice that low carbohydrate diets really help ladies who have lipedema. So the ketogenic diet, any kind of anti-inflammatory low carbohydrate diet. There's a diet called Bright Line Eating, and they have a support group online. It's a very rigid, low-carb eating if that's what you need. And intermittent fasting seems to help. And I had one lady who got rid of her lipedema fat by using keto plus intermittent fasting. Obviously, you should talk to your provider before you start any different eating plan. A lot of these need to be followed. You need to get your blood checked, make sure your electrolytes are okay. And the worst thing I think to do is to go on a diet, lose weight, and then regain it. Basically, what you're doing is changing what you're eating rather than going on a diet. Inside sick fat, including aged fat or people who have diabetes and have obesity, you're going to find senescent cells. And you remember our picture of our cells here with fibrosis and our cells here that are dead. So their senescent cells aren't exactly dead, but they're just not functioning at all. And they send out signals to the body and they make the fat around them sick. And any kind of stressful state can cause you to have senescent cells. And so what they're working on, and you can look this up yourself, they're looking at what are called senolytics. And these are medications and supplements that help kill off these senescent cells so that you can heal, so that you don't have a healing disorder. And in fact, intermittent fasting is one way to get rid of these senescent cells. And there's a couple papers out that say it's the most effective, non-genetic, non-drug to kill off those senescent cells. So definitely something to think about and talk to your provider about. There's other senolytics. These include metformin, resveratrol, some kind of licorice that can actually cause you harm, fisetin, which is found in strawberries, and quercetin, which is found in many fruits and vegetables. So I don't know the exact dose of these. Again, this would be something you would want to talk to your provider about, whether you should be using any of these. But I think it's hopeful that perhaps by using food and natural supplements that we could heal the tissue that has a healing disorder. Another important vitamin for you to take that reduces the development of fibrosis. It doesn't reduce fibrosis once you get it, but it reduces the development of fibrosis is vitamin D. And they gave vitamin D to people who had lower levels of vitamin D and brought it up above 30, and their fibrosis went down. And it went down in their fat tissue. So definitely something to talk to your provider about. Keep your vitamin D levels within the normal limit. I found out from Jacek that you can now get melatonin in Sweden by prescription. And I think your dose is 1 milligram and 3 milligram. And I know that people who have lipedema and Derkham's disease and lymphedema can have trouble sleeping. And if you have trouble sleeping, then you're not very good the next day, and it actually makes you more insulin resistant. So you want to sleep at night, right? You want to sleep at night and be awake during the day. Melatonin is a hormone we all naturally have. As we age, our melatonin levels go down. If you have a healing disorder, your melatonin levels go down. So perhaps you could speak to your provider whether melatonin would be a good supplement for you to take. A common dose is 5 milligrams in a lot of the studies that I looked at, but some of the studies looked at doses as low as 1 milligram. And I know a lot of ladies with lipedema, especially in the later stages when the fascia is starting to lose its elasticity and fold. You don't want that to happen, right? If that happens, you're at risk for developing lymphedema. So melatonin is known to improve skin quality and improve elasticity and keep us young looking. So we all want that. And it's really not effective to get your blood level of melatonin checked. It doesn't work. So you either take the supplement or you don't. And they actually looked at melatonin and fat function, and they found that melatonin helped improve the number of brown fat cells that people had. And brown fat burns energy. And burning energy is good. That's really healthy fat. And they did that with only 3 milligrams of melatonin a day. And this is an inflammatory cascade. So if you have any kind of tissue injury, and you have tissue injury now that we know, if you have lipedema or Derkham's disease, right, you have fibrosis in your fat. So this whole pathway gets activated if you have lipedema or Derkham's disease, and you get pain, stress, anxiety, and sleep disturbance. And melatonin actually helps inhibit this inflammatory pathway at multiple levels. So it is an anti-inflammatory supplement. And what are the side effects? It's relatively non-toxic. It's been administered in up to 1 gram a day in people, and their only complaint was that they were sleepy. So the most common reported side effects are headache, dizziness, nausea, and drowsiness. Drowsiness is what you want at night, but certainly not during the day. Mechanical treatment of fibrosis. Ooh. What happened? Did it lose power? So I'm just going to keep talking. So there's mechanical treatment of your tissue. So once you have fibrosis, really the only way that I know to get rid of it is by liposuction. Is everyone going to get liposuction? No, that's ridiculous. That's impossible, right? You can't liposuction your entire body. So what can you do? So mechanical treatments do help reduce fibrosis. And we did a study on quadrivis therapy, which is deep tissue treatment. And we showed that you could reduce fibrosis in the fat tissue of women who had lipedema, and many of them also had Derkham's disease at the same time. So this deep tissue therapy is only available in the Netherlands. So if we could get someone from Sweden to get trained, it would be great. There'd be people here available. But there's other types of manual therapies that help reduce fibrosis. So I'm sure you've heard of myofascial therapy, right? Myofascial release, myofascial therapy. And it treats the fascia. And we know that the fascia has a problem in lipedema and Derkham's disease. So how perfect. There's Rolfing. Didn't Rolfing come out of Sweden? Isn't Rolfing a Swedish massage, kind of? Rolfing?
Give me your stick.
So Rolfing is also a myofascial treatment as well. So I'm trying to give you names of different treatments that you should be able to find in your area. So myofascial release, Rolfing, also deep tissue therapy, any kind of deep tissue therapy that treats the fascia. So if you're getting massages, you should be asking about that. And it can hurt. It can hurt, and you kind of have to be prepared for that. But sometimes when things hurt, it feels really good, right? You go, that really hurts, but keep going, because you know it's the right thing. If it hurts, painful hurt, then I think you're going to have to work with your massage person and get them to help you in a different way. Also rollers, right? Have you seen rollers? I brought a roller with me. Let's see, I have to get out all my toys. So yeah, this is a foam roller. Yeah, and not everybody can. I'm still going.
Oh, you're going.
I'm still going.
Okay.
So not everyone can get on the floor and roll on a foam roller, right? I mean, that's true, and it's kind of difficult. And if you have hypermobile joints, it's hard to balance, But I bought this small travel foam roller, and you can put this against the wall, right? This is a lacrosse ball. It's firmer than a tennis ball. Bounces really good, and you can put this against the wall, and you can roll all the fascia on your back, and especially here on your hips where there's a huge chunk of fascia, and then that low back. This works great, and it costs about $5 US. I mean, $5 well spent. And I use this in my clinic, and I have my ladies do it, and I say, I'm going to go print up your report, and while I'm gone, I want you to give yourself a treatment. And they're there, on the wall, and it really makes a difference. $5. You guys can get that. I'm sure you can get it here, right? They play lacrosse in Sweden, right? And it comes in different colors. Should you use a fascia blaster? That's a question I always get. I would say be very careful with anything that treats too deeply into the tissue too fast. You still hear me? Too deep into the tissue too fast. You want to think of fat in layers, right? So you've got fat, fascia, fat. So if you dive down deep to get to the muscle, what have you done to your poor little fat above it? So you want to treat it like dough. Roll it. You don't immediately roll out the dough and push the roller straight to the board, right? You roll the dough. So think about treating the fat in layers, and over time, you're going to get deeper and deeper and deeper until you get down to the fascia and down to the bone. So we talked about some of the tools, and I'm going to show you some of those here. You can also go to a physical therapist who can work with your fascia using tools, and this is called ASTYM therapy, ASTYM, or Graston technique, Graston. And in the US, I just write a prescription, and my patients go to the physiotherapist, and they know these techniques, and you can ask around who does these techniques to help treat your fascia. And some of my ladies with lipedema, I say, let's treat your fibrosis around your knees. And they go, and then they call me and they say, I'm done with that. Can I do the rest of my body? So it really, really works, but you have to keep doing it over time if you haven't gotten into a healing phase. There's also tools called gua sha, and there's a lot of people in the U.S. with lipedema and Derkham's disease that are doing cupping, and it really helps improve blood flow. And we showed with our study that when we did that deep tissue therapy, we could reduce fat, and we could reduce about that much on the leg. Not a lot, but I think more importantly, we reduced fibrosis. And we could see that fibrosis around the blood vessels. So these little donuts here are actually blood vessels, and you could see flow through them. And after the 4 weeks of therapy, the blood vessels had healed. So with deep tissue therapy, you can heal your fibrosis everywhere, in the fat, in the muscle, around blood vessels. And when we looked at caliper measurements, how thick was the fat tissue, which is a different measure of fibrosis, we reduced it in the arm, the trunk, and the legs. So anywhere you get the therapy, it should help reduce your fibrosis. So here's a list of mechanical therapies. The rolfing, as I mentioned, stretching, foam rollers, and the lacrosse ball. And we also know that pumps help reduce fibrosis. So you have the LymphaPress pump here, or a basic pump. Any kind of pump should help reduce your fibrosis. And you can search online and find these things called pit packs if you have a pump. And they're cherry pits, like in a bean bag. And you stick them under your pump, and when your pump squeezes, it drives the cherry pits into the tissue, and that helps reduce fibrosis. And if you go to a physiotherapist and ask them about pit packs or cherry pit packs, they know about it, right? Yep, so you can search online for those. We also know that compression garments help squeeze inflammation, fluid, and those extracellular matrix proteins and little tiny clots out of the tissue. So I really do support the use of compression. And finally, I'm going to talk about oral collagen. So this is something that we discussed at the Fat Disorders Resource Society conference in April. And if you have hypermobile joints and you have pain, collagen may be one way to treat that. It is also known to improve skin elasticity. Do you guys remember what else improves skin elasticity? Melatonin. Good. So they also found that the collagen reduced fat cell size. If your fat cell size is smaller, it's a healthier fat tissue. So collagen can help improve elasticity and reduce fat cell size. Should you take it? There are promising results for the short and long-term use of collagen for wound healing and skin aging and skin elasticity, keeping skin hydrated and keeping our fascia within normal limits, but we don't know the dose. Can't tell you a dose, which is unfortunate, and we need more studies to figure that out. Also, at the FDRS conference, we presented our results from an injectable drug that is being developed by Raziel Therapeutics. We injected this drug into 6 people who had Derkham's disease and 6 women with lipedema. These are the results from Derkham's disease. And we actually injected it directly into the lipomas. And what it does is it causes the fat to die. And so the next day, everyone was saying, hey, look, my lipomas are smaller, which is what we expected. And then we did the study for 56 days, and we got about a 55% reduction in lipoma size. And then when I went back 6, 9 months, 18 months later, I looked for the lipomas and they were gone. So we think it takes a lot longer for them to go away. The side effects were burning, itching, and irritation. So the ladies with lipedema, when we injected them above their knee, they refused to put their pants back on. And we watched them all day long. We watched them for 8 hours, and we did heart studies on them the whole day because that's what we have to do for a clinical trial. And they didn't want to put their pants back on. But by the end of the day, they were fine. They put their pants on and they went home. And they had no complaints after that, which was interesting. They also had a 75% reduction in pain. And at the end of 56 days, even though the lipomas weren't completely gone, I said, well, what did you like anything about the study? And they said, my pain's gone. That was what they liked the most. So in conclusion, fibrosis may be a main reason why adipofascial fat is resistant to loss by diet, exercise, and bariatric surgery. And we think it may result from leaky vessels. It deposits fluid and proteins and cell waste in between the fat cells. This causes poor lymph flow and it causes fat to grow. And you can reduce fibrosis by liposuction, maybe by some supplements and medications, so stay tuned for that. Also, manual therapies, pump therapies, and compression garments. And I think, intermittent fasting, eat for only part of the day, and it can vary from 8 hours to 16 hours, is a really effective way to kill off those senescent cells and make your fat a lot happier. Thank you very much.